I'm Dr. Howard Walpole, and I'm the Chief Medical Officer for Okyanos Heart Institute. My part in this really sort of grew out of my experience with balloon angioplasty and the creation of stents, which happened about 25 or 30 years ago. I was very fortunate to come out of training at a time when that technology was really in its infancy. The guy who developed all of the balloon angioplasty technology, Dr. Grunzig, was located at that time at Emory University, which is where I trained. And so we really got on the ground level of treatment of epicardial obstruction using balloon technology. That technology has grown over the last 3 decades to the point where our success rate is tremendous, the safety record is very, very clear, and I've enjoyed the last 25 years of being a part of that wave. But I believe that that wave has sort of reached its peak, and there's very little new technology in the realm of stents. And we've gotten to the point, as I said, where we can treat epicardial blockages fairly well, either with stenting or with bypass surgery. But the problem that we've not really taken care of yet is treating the muscle itself, the damaged tissue, and the areas of the heart where you just don't have enough blood flow, but you're clearly having symptoms because of those areas of the heart. And so I think stem cell therapy is what's going to be that next wave in medicine. I'm excited about being part of that wave and improving those areas of the heart, making patients better, and hopefully reducing their mortality. Heart failure is the #1 DRG in the United States. It's the #1 thing that we spend money on in healthcare in this country for cardiology. This is just a huge area that we've got to attack. I've been involved in that area of cardiology as well through the American College of Cardiology. We're trying to find new ways to treat patients that are less expensive, more efficient, with better outcomes. And so I believe that stem cell therapy is going to be part of that new wave as well for the reduction in the overall cost of healthcare. Well, certainly stem cell therapy, I believe, is going to be a key part of the treatment for heart failure in the future. But it's important for patients to remember that this is not a cure for the underlying disease that caused the damage in the first place. Coronary atherosclerosis, or coronary artery disease, is really an ongoing disease. We don't have a cure as of 2012. So it's important that since we don't have a cure, to focus on those things that we know are risk factors. So it's still important that patients focus on good control of blood pressure, good control of their cholesterol. Patients who smoke need to stop smoking. We know it's a big risk factor. Patients who have diabetes need to follow all of their doctor's recommendations on keeping their blood sugar under good control. Patients need to exercise on a regular basis. We know all of these things tend to affect the incidence of that disease. Because even if stem cells do work and do what we believe the data has shown and make the heart muscle better, the patient might, at some point down the line, suffer another heart attack because they haven't treated or dealt with the underlying disease. So it's very important as a part of this treatment to focus on those risk factors and modify those factors as much as possible to reduce the incidence for more coronary disease. Well, our plan is to stay in touch with the patient and their physician to find out how they're doing, to have some follow-up, to talk about risk factors. We want to support the doctor at home. And basically, we would love to find out how they're doing, see what the incidence is of the complications of heart failure after our treatment, and help them in any way we can to get a hold of this disease and get the symptoms under control.